Hello everyone, welcome to this presentation on nutritional needs of surgery patients by Group 2 Institutional Management members. I am going to be the presenter and my name is Mercy Chepkirui. Here is a list of Group 2 Institutional Management members. Let us start by looking at the objectives of dietary management for surgery. The first one is to improve the preoperative nutrition whenever the operation is not of an emergency nature. The second one is to maintain correct nutrition after operation as far as possible. Then lastly, to avoid harm from injudicious choice of food. Then we have the categories of nutritional needs in surgery, and they are categorized into two. There is preoperative nutrition and postoperative nutrition. In preoperative nutrition, it's the kind of diet which is offered to an individual before the surgery, and the surgery demands should be made by the diet of the individual. In most cases, it should comprise of a light diet. The preparation should correct any nutrient deficiencies and should provide for surgery itself and postoperative period until feeding can resume. And the diet should comprise of the following. The first one is proteins, and protein is the most nutritionally deficient nutrient related to surgery, and it is essential for tissue and plasma formation. It controls blood loss during surgery and prevents tissue catabolism in postoperative period. There is also a requirement for energy. In this case, sufficient kilocalories are required to build weight deficit, and carbohydrates not only provide energy to the body but also forms glycogen stores to spare protein from tissue synthesis. There is also a need for vitamins and minerals, and vitamins are required for carbohydrate metabolism. The minerals correct anemia, maintain water and electrolyte balance, and control dehydration. Vitamins and minerals also correct acidosis. Food should not be ingested at least 8 hours before the surgery to avoid vomiting and aspiration during surgery or recovery from anesthesia. So you make sure that any individual who is undergoing surgery or who is supposed to undergo surgery takes his or her meal at least 8 hours before the surgery. Then let's look at postoperative nutrition. This is the nutrition support after surgery. So nutritional therapy is an important means of replenishing surgery-induced physiological losses, and the diet should comprise of first, proteins. Adequate protein intake is required to replace losses and increase supply where there is a catabolic period with negative nitrogen balance. The loss also occurs through hemorrhage, wound bleeding, metabolic losses through tissue infection and trauma, immobilization, and poor caloric intake. Protein is needed for tissue healing to avoid shocks because of low blood volume. Besides, proteins are important for controlling edema, for bone healing, and resistance to infection and lipid transport. There is also a need for energy, and carbohydrates are needed to allow protein for tissue synthesis and for increased metabolic demands. And in this case, 2800 kilocalories per day are needed to avoid liver damage through glycogen depletion. Fats in small amounts are also required to maintain tissue reserves. And then there is also a need for fluid, and losses through vomiting, hemorrhage, diuresis, fever, sweating, and increased metabolism do occur. According to individual needs, fluid is recommended to avoid intoxication and dehydration. Then we also have minerals, which you need to replace mineral deficiency and ensure adequacy of each mineral. Like potassium and phosphorus are lost in catabolism. Sodium, chloride, and iron should be sufficient. Vitamins, all vitamins play important roles for wound healing. And vitamin B is important for carbohydrate metabolism, while vitamin K is vital for blood clotting. Let's finally look at the modes of feeding. And in postoperative surgery, you can either choose any of the following modes of feeding. It could be oral feeding, which is feeding through the mouth, tube feeding, use of tubes, or parenteral feeding, which can either be partial parenteral nutrition or total parenteral nutrition. And you can either choose partial parenteral nutrition, which is feeding through peripheral veins, or total parenteral nutrition, which is feeding through the central vein, depending on the individual conditions. Up to this far, we've come to the end of our presentation. Thank you for following.